A political earthquake is shaking the foundations of the UK's healthcare system, and it's happening right now. The British government has just announced a decision that could redefine the future of the NHS, a move so controversial, so unprecedented, that it has already ignited fierce debates across the country. We're talking about the abolition of NHS England, the independent body responsible for running the health service now being completely dismantled. The government says it's about cutting bureaucracy and putting power back into the hands of the people. But is this truly a lifeline for our struggling NHS, or a dangerous political gamble that could put lives at risk? We're diving deep into the facts, the controversy, and what this means for you. Stay with us.
That we're going to do things differently. We're going to tell the truth, even when they are hard truths.
For years, the NHS has been drowning, underfunded, overwhelmed, and overstretched. Waiting times have skyrocketed. Patients have been left stranded, and frontline workers. They've been pushed to breaking point, but now the government claims they have a radical solution: bring the NHS back under direct control. No more arm's-length bureaucracy, no more management layers, just raw government oversight.
I don't see why decisions about £200 billion of taxpayer money on something as fundamental to our security as the NHS should be taken by an arm's-length body, NHS England. And I can't, in all honesty, explain to the British people why they should spend their money on 2 layers of bureaucracy. That money could and should be spent on nurses, doctors, operation, GP appointments. So today I can announce we're going to cut bureaucracy across the state, focus government on the priorities of working people, shift money to the front line. So I'm bringing management of the NHS back into democratic control by abolishing the arm's-length body NHS England. That will put the NHS back at the heart of government where it belongs, freeing it to focus on patients, less bureaucracy, with more money for nurses, an NHS refocused on cutting waiting times at your hospital. Now, tough choices won't just stop there. In this era, they will keep on coming. Our task is clear: national security, national renewal, driving change forward with a plan for change, focused on the interests of working people, securing our future together. Thank you very much indeed for listening to me. Thank you for being here.
At first glance, it sounds promising, doesn't it? But let's peel back the layers, because beneath the surface, the reality might not be as simple as it seems. First, let's get the facts straight. NHS England was created in 2013 as an independent body to manage the health service free from political interference. The idea: keep decisions about patient care in the hands of medical experts rather than politicians. But now, in a move that has stunned experts, the government is scrapping it altogether. Their argument: too much red tape, too much wasted money. And they claim that billions of pounds in taxpayer funds will now go straight to the frontline, hiring doctors, nurses, and cutting waiting times. But here's where the controversy kicks in, because critics warn that this is nothing short of a power grab. The NHS will no longer be run by an independent body. Instead, it will be at the mercy of politicians, the very people who have been accused of mismanaging it for years. So who wins in all of this, and who loses? Well, let's look at both sides. The government insists that cutting layers of management will get rid of inefficiencies. They claim that this will save taxpayers money and refocus the NHS on patients, not paperwork. Health experts are already warning that political control over the NHS could lead to disaster. What happens when medical decisions are made by politicians rather than professionals? Will funding be allocated based on what's best for patients, or what's best for winning elections? Doctors, nurses, and medical unions are furious, calling this a reckless move that could open the floodgates for privatization. Remember, This government has already flirted with outsourcing healthcare services to private firms. Could this be their endgame, the first step towards breaking up the NHS as we know it? So where does this leave us, and more importantly, what does it mean for you? The truth is, we are standing at a crossroads. Will this shake-up finally deliver the NHS we deserve, or is this the beginning of the end? The government is pushing ahead, but the backlash is growing louder by the hour. So here's what to watch for next. Will Parliament challenge this decision? Will healthcare professionals strike in protest? And will we, the people, have a say in the future of our health system? This isn't just about politics, it's about your healthcare, your family, your future. So now, we turn the question over to you. Is this a bold move to save the NHS, or a dangerous mistake that could lead to disaster? Drop your thoughts in the comments, we want to hear your voice. Make sure to subscribe and hit that notification bell, because this is a story that is far from over. We'll be following every twist and turn, bringing you the facts that the mainstream won't tell you. Stay informed, stay empowered, and as always, we'll see you next time.